Well, there's a growing trend on college campuses all across the U.S. Doctors say they're seeing more cases of anxiety and more students seeking help at mental health facilities than ever before. Special correspondent Sheila Gray has more in tonight's Family 411.
Young people on their own for the first time are feeling the pressure. Heightened expectations about grades, money, friends, and a successful career are more often leading students to the campus mental health clinic.
Every year there is an increase, and it's a small one, but it's a steady one, and it's been like that for at least the last 15 years.
Dr. Michael Meyer helps students cope with stress, panic attacks, and anxiety, all common now at colleges across the country. And he says about 1 in 4 college students are using medication to deal with it. The American College Health Association surveyed students at 57 colleges and universities last year. More than half said they felt overwhelmed. About half of the 32,000 students said they felt exhausted, and about 1 in 5 said they felt overwhelming anxiety. And many of the college students cited difficulty handling things like academics, relationships, and lack of sleep.
I went to counseling for about a year, and it was huge. It was a huge step in the right direction for me.
Senior Kayla Alton and junior Lindsay Mooney have leadership roles in the campus group Active Minds. Its goal, getting young people to talk about mental health.
When someone's struggling with anxiety, it's always tempting to think, like, it's just me that's going through this, because not everyone talks about it.
Mental health educators say one of the best things parents can teach our kids before they ever get to college is how to deal with failure.
And how to overcome and to kind of regroup. And I think helping our children to understand that failure is not a statement about the person. It's not how many times you get knocked down, it's how many times you can stand back up.
Kayla and Lindsay have learned how important it is to care for themselves and each other.
And I think we need to focus on being good to our bodies and being good to ourselves.
It's so important for us to be able to talk to somebody like, hey, I've noticed these things, do you want to talk about what's going on?
It is a generation more open to seeking help, and universities are much more equipped to handle it. Progress on the road to what Active Minds calls changing the conversation about mental health. Sheila.
So important to destigmatize mental health issues. Well, Active Minds has more than 400 chapters across the U.S., and we have put up a link to Active Minds on our website, fox45now.com. Just click on News Links.